Hi, everyone. I am Valletta, proudly the CEO and co founder of Culture Plus Group, which is a family of cultural intelligence companies. And honoring cultural intelligence, we're going to have a great conversation today with an amazing leader, a great friend. And yes, she also happens to be the chief medical officer for our group, Dr. Sheri Prentiss. Hello, Dr. Sheri. It's great to see you.
Hello, Lily. It is so wonderful to see you too. And thank you for this opportunity to just have this little chat with you today.
Exactly. But before we even start talking about what we're talking about today, I want to make sure people know who Dr. Sheri is. In fact, I often say just Google her because you can see that you are not only an MD with many credentials, but you're a visionary, best selling author, highly sought after physician leader, speaker, and the list goes on and on. But what I love, Dr. Sheri, about you is that you are very open and inspiring in your personal life journey, not only being a physician and a researcher, but also having been a breast cancer survivor and advocating for patients of all colors, genders, and sizes so that we can have better outcomes and better health. So, thank you for your work. And we're going to talk a little bit about health equity and social determinants of health. So, starting with that, social determinants of health and health equity have become very hot topics, especially after the season of COVID. And I want you to just very, simply for those that are watching, tell us, first of all, what is it, right? That is health equity and social determinants of health. And why should we even care to talk about these factors in the world of healthcare marketing and the business of healthcare? So go for it. Tell us more.
Well, it's funny because, in recent years, the issue of health disparities has become a significant concern in the healthcare industry. And you and I, having lived the health disparities situation, if you will, we felt that this has been a conversation of ours for us, for our parents, for our grandparents, for me, I know even my great grandparents. And so I am very happy that it is now on the forefront and has become a significant concern in the healthcare industry. And health disparities, it is well established that certain populations, such as minorities and low income individuals, they are disproportionately affected by health disparities. And so by addressing these disparities, it's not only critical for ethical reasons, but also for improving patient outcomes, promoting public health. And we as healthcare professionals and pharma, we both have an essential role to play in addressing these health disparities. And by collaborating and by working together and promoting cultural competence, we can all work together to ensure that patients from all backgrounds receive high quality care and improve health outcomes for all. That really is the main premise of when you're talking about health disparities and health equity. It is really providing a situation where there is high quality health care and better health outcomes for all. And we know that the social determinants of health determine access and quality of medical care. Matter of
Mhm.
fact, healthcare access and quality are one of the 5 key areas of the social determinants of health, which presents a fantastic opportunity for collaboration within the healthcare sector amongst healthcare professionals and pharma.
Yes, I love what you're saying because, many times also people think that health equity matters or SDOH are to be addressed by somebody else, but not necessarily maybe the pharma companies. But there is a role that they can play, and sometimes even participating in unusual places. I know, a lot of people that are watching us clearly may not know this, but you are even the creator of Medicine Meets Ministry, which is a blueprint, right? And a
Yes.
guideline that brings together places and spaces of faith and worship to actually help us carry this message forward. So I know there's many ways companies can maybe reimagine how they can reach out into our communities and empower and bring this health equity forward. Tell us about some of those ways, and maybe ministry and even untraditional partnerships is one of those ways. Because, by the way, for those watching, we do have an article, an amazing article that Dr. Sheri has written. It's a great cheat sheet for the ways in which pharma can support HCPs and help minorities in empowering better outcomes. But tell us more, and I do want to learn more about how the world of ministry and community can even play a role in the ways we can make a difference.
Yes, yes, absolutely. Thank you for bringing that up. You know, one of the things that I want to clarify, there are sometimes when people think about it, they hear the terms health disparities or health equity, they tend to think that working on minority health is in some way, you know, charitable work. We're helping the less fortunate. And, you know, I have the tendency to view charity as, you know, helping someone who may have fallen on hard times. But the reality is, especially here in this country, it's not a place where we've fallen. It's a place kind of where we were forced to be. And so health equity truly is a social responsibility, but it's also a smart business move. It's
Mhm.
smart business because diverse populations are growing. You want to pay attention to them. You want to understand their demographics. You want to understand their needs and be able to be in a position to meet those needs because those are going to be your consumers. Addressing health disparities can improve health outcomes. When you improve health outcomes for one sector with the intent and the mindset that this is health equity, so I'm improving it for all, when you raise the level, when you raise that bar of health where it's impacting and affecting all individuals, then you raise the social consciousness, and now you also raise the level of health throughout the country. And so when we all have better health, we all experience a better level of living. Addressing these health disparities also builds trust and loyalty. And I'm sorry, for whatever brand you have, building that trust and loyalty should be at the forefront of your mind because you want to gain consumers and customers that trust you and that are loyal to your brand because they realize you are giving back. You're in it to win it. You are in it for the better good of everyone. And then, you know, when you think about pharma, there may be some regulatory issues that you may need to be cognizant of. But some of the ways that I suggest, and these are really some of the easier ways that,
Mhm.
let's say, particularly pharma could join in and work to help HCPs support and help minority populations. Simple things: a comprehensive education and training approach, working with HCPs and giving them the education and training that they need, access to resources, developing, get this one, treatments and therapies tailored to the unique healthcare needs of minority populations. If
Mm.
you know you're already addressing and knowing that minority populations are quickly moving to the majority minority. I mean, there are certain age groups where the majority has already been met with a minority population.
That's right.
If you understand and appreciate that by 2040, you're looking at a majority minority, why wouldn't you be working right now to develop new treatments and therapies tailored to the unique healthcare needs of your majority population that is quickly coming around the bend sooner than you think? They can also support community health programs. And then
Mm.
they can offer continuing education programs. So when we're talking about that medicine meets ministry, when we're talking about those kind of unique ways that organizations can help and work with HCPs, part of that medicine meets ministry, supporting your community health programs. I mean, that is an absolutely wonderful way for individuals who may, one, maybe have a concern as to, well, you know, where are the influences? You know, are there, does this brand really truly care about my overall health, or are they mostly concerned about if I'm taking this particular medication?
Mhm.
Well, when individuals of the community can see participation and help from a brand that is beyond this particular product that's being offered, but they're now indwelled in and a part of the community because they want to see this particular community grow in health, in knowledge, in wisdom, in activity, in lifestyle changes. When you can partner with your healthcare practitioners within the community, these other organizations helping healthcare practitioners gain the knowledge and the skill set and have the tools available to them to really be able to impact a patient's life, not just when disease is present, but let's now begin to work with the communities prior to the disease. Let's work on preventive health. Let's do things within the community where I can understand that participating in A could lead to condition B, and B is something that I would have to live with for the rest of my life. And so there are organizations out there pouring into community programs that say, beyond high blood pressure, I want to make sure that, you understand what smoking cessation can do for you, where you can understand the benefits of yoga and other holistic means of caring for yourself can do. When individuals can feel like, oh, wow, my entire well-being is at the forefront of their brains, then that means anything that they have to say to me, I'm going to listen because they have my best interest at heart. Winning a patient's loyalty and trust, man, you have a person for life, because we need individuals helping us and guiding us to lead a healthier life. We need individuals to help us when we discover a new disease process. When I can now reach out to the same source to get information about how to prevent a disease, in addition to how to treat it, then they become a loyal source that I want to go to time and time again.
I love it. And again, for those that are watching, there is a whole article full of gems of wisdom of the different ways pharma companies and healthcare professionals and leaders actually can support this very critical need for filling gaps in care through addressing social determinants of health, promoting health equity, and to kind of wrap it up, because you just said it so beautifully, Dr. Sheri. I heard a couple of themes. First of all, it's not charity work. Then I also heard you re-emphasizing the fact that we will quickly become a majority minority nation by 2040. And why not start planning and serving and innovating towards the serving of that majority, right? That very quickly will be who it makes up the core of our patients and the populations we serve. And last but not least, as you were talking about these community programs and maybe non-traditional ways of reaching out, like through ministry or other health organizations that may not be a hospital, but maybe there are other volunteer groups at the community level, that all of that is enabling the big pharma companies or the big brands we know out there from products to earn their right to market. And you're earning trust by showing up in a consistent way in the places and spaces where people live, eat, pray, shop, and belong in their community. So I think there's a lot of wisdom here. Click the article, keep searching and learning more about Dr. Sheri, because you're teaching around this space. You're a force for change, Dr. Sheri, in healthcare. And I just love the fact that we can have this conversation. And just to finish up, I guess, if you were to give that person watching right now a piece of advice, practical advice of the, hey, Joe or Jane or Jill, this is what you can do to get started in this journey, and what would you tell them as some like final words, quick way to get going and stop just thinking about it?
Okay, go beyond your traditional marketing and get involved in community engagement.
Bingo.
The reason why I'm telling you community engagement, because it will help your business not only build relationships with your customers, but you're going to develop a deeper understanding of their needs and their preferences. And when you engage with the community, your business builds trust, credibility. You will gain valuable feedback on how you can meet the needs of this community, and you will create a sense of belonging among your customers who will stay with you for life.
There you go. These are the wise words and great article written by Dr. Sheri. Once again, you are a proven visionary, best-selling author, highly sought after physician leader and speaker. And in case you want to know more, my goodness, Dr. Sheri has even been featured in the New England Journal of Medicine, Essence, Oxygen, so many different places, the Chicago Tribune, the list goes on and on. So we are in the presence of a great authority in this space, and we're so proud and glad to have you as part of our team, Dr. Sheri, as our FEARS leader, as our chief medical and public health officer. But today we want to democratize that for others to also take action. So thank you so much. And now there's no excuse, everyone should go and get started.